You know what time it is. Time for your very favorite segment of the week here on Facebook Live. Let's talk NCLEX. Woo! We are excited, not only about the question, not only about the testimonials, but the content review that we have today, because it comes specifically from nursing students just like you. So I will be doing the Ask Remar section today. And I love when you guys, send me these emails throughout the week, because it helps me to stay in my content game. Number one on top, the best NCLEX instructor in the world, Regina Callion, MSN, RN. I worked really hard for that master's in nursing education, but I did it by the grace of God. And so I'm happy to share with you guys all of the knowledge that I have, and however that you need it. One of the things that we always start off with is our testimonials, and you guys know that they are amazing. But I get nursing students who watch these segments. They watch Let's Talk NCLEX, they watch Motivational Monday, and they want to personally experience the success of our nurses. Is there anybody just tired of having NCLEX hanging over your head? Tired of the challenge of studying? You're just tired. You're so tired of not working in the career that you were educated for, because you have this test that you have to pass. I mean, NCLEX is no joke. It is a big exam, but what makes it so exhausting is that there are so many resources, and there are so many people telling you to do it this way or do it that way. Like, everybody is telling you guys to do. I mean, I got an email from a student that says part of her homework assignment was to do 400 questions like a day from an NCLEX instructor. And I find the students, they're beat down and they're tired, and everybody's telling them to do this or that. But listen, guys, I'm telling you that this process is very streamlined when you have the content that you need. There is a way that is laid very simply, very easily. You know what? I could just talk about this all day long, I swear. But if you guys want to know what I recommend and what I think is best for you guys and the students that I've helped, the thousands upon thousands of students, check out the website, remarreview.com. As soon as you get off of this broadcast, it's simple, straight to the point information that will help you get out of that rut of trying to study for this exam. And I know it seems impossible, but you guys can do it. So our testimonial comes actually from a student who a lot of you guys might relate to, because she just got some bad advice about NCLEX, just like some really horrible advice. And for me, it's kind of disappointing, because it actually came from an educator. And I think as nurse educators, for myself, we have to stop blaming nursing students who are not understanding the way that we teach. And so I myself, when I'm teaching to you guys, I know that I'm talking to a visual learner, an audio learner. I know there's a kinetic learner out there that's watching these videos, and I have to be responsible for all of you guys getting the information at the end of this segment. So let me just go into my testimonial. Listen, share this video. Look, okay. This is a testimonial. Woo. Regina, first I want to say thank you. I brought your self-study program review for RN. Let me tell you my story. I passed nursing school, took the NCLEX, and failed my first time after studying blah, blah, blah. It don't even matter. You guys fill in the blank. Fill in the blank of what that program could have been, what that strategy-based program could have been. She says, anyways, my first time after studying blank, which the hospital I'm going to work for, they paid for this. They paid for this review. Well, I had already had your quick facts book, but didn't study it because this educator advised me against it. When I failed, I brought your self-study program. Well, this was the best thing I had ever purchased. Almost everything in quick facts was on the test. Thank you again, Regina. Remar nurse Michelle RN. It blew me away that I was getting another testimonial from a nursing student, but this nursing student was actually advised not to study the quick facts for NCLEX book. How is that even possible? How can you say do not study a book called Quick Facts for NCLEX? I mean, and I know it's something that a lot of people have never seen or heard of before, but once you have that book in your hands, you know it's the truth. Like, you know that this is a great way to prepare for NCLEX. And so anybody who's really serious about their NCLEX needs to have quick facts, period. It is just one of those books. And the reason why I think that it's such a great book is because literally it's core content, and I'm constantly updating it. I'm constantly improving it. My nursing students, you guys really give me the most awesome feedback on all of the Remar products. And so they meet you right where you are. So anyways, my girl, Michelle got some terrible advice. Not to study her quick facts book. So after she failed one time, she said, you know what? I have to take responsibility for my success. And I'm telling you, for Let's Talk NCLEX, every one of you guys out there, you have to take responsibility for your own learning. Do not fall into the trap of, well, this worked for so-and-so, or everybody's doing this. No, what do you need to do? How do you learn best? Because at the end of the day, when Michelle went in there to take her exam for the first time, that educator was nowhere around at all. And so she did what she had to do for her second time around. So if you need to raise your hand and say, I need to take responsibility for my preparation for this process, have that conversation with yourself, because it is going to be super beneficial to you getting out of your emotions, getting out of not feeling like studying or waiting around for somebody to do something for you, and just you going out there and doing it for yourself. Okay. So I'm gonna get off my hobby horse on that note, but I know somebody needs to hear that. Vivian, you passed. Congratulations. Hi, Regina. Thank God I passed my NCLEX with 76 questions. I'm so grateful to God, and thank you for all your motivation. It took me a long way. You are an angel. Oh, thank you so much. May God bless you as well every day. Congratulations. Is there anybody else that would like to interrupt the broadcast with a praise report? Because we're open now for that. Okay. All right. My Remar nurses love the Quick Facts book, as I'm reading the comments of people who have the book. Anyone who is serious about their NCLEX preparation has that book, and stray from those who tell you that it is not a great way to study, because it absolutely is. I love it. All right. Okay. So thank you for all that you guys do. The community, the conversations that are on here, sometimes they are so distracting to me because they're so good. And so I want to indulge in the conversations, but I will digress and stay on topic. This is Let's Talk NCLEX. It's how we spend our Fridays. Thank you for spending a couple moments with me here to go into your weekend. All right. So, all right. Oh my goodness. Are you guys ready for your question of today. And not just one question, but there will be several questions to get your brain going and letting us have just a really good study session today. All right. So here is the question that was on the Facebook page. I got a lot of, oh my goodness, I got a lot of answers. Let's see how we do today. All right. A nurse is caring for a client who was just notified of a lung cancer diagnosis. The client blames his wife for smoking inside their family car. Which stage of Kuber-Ross's 5 stages of grief would best describe this client? I'm going to read it again. A nurse is caring for a client who was just notified of a lung cancer diagnosis. The client blames his very own wife for smoking inside of their family car. Which stage of Kuber-Ross's 5 stages of grief would best describe this client? Our choices are number 1, bargaining. Number 2, denial. 3, depression. 4, anger. Or 5, attack. I see the answers. Once you write down your answers, go ahead and share this video so I know that you have finished your answer choice. I see 5. I see 4s, 5s and 4s. 2. 2. Okay. Okay. This is one of those questions where, you either know about Kuber-Ross's 5 stages or you don't. You don't at all, okay? And I spoke to a student on the phone today. I was actually did a phone conversation, and he had just taken NCLEX but failed it, 205 questions. And he said, I got to go back to my content. I just got to go back to my content. So here we go. Ready for the answer, you guys. I see. I'm guessing 5, 4, 2. All right. You don't have to guess. You don't have to guess. You got, all right. All right. So here we go. This is just for you guys' edification. The 5 stages are denial, anger. If you don't know this, write this down. If you don't know it, write it down. Denial, anger, bargaining, depression, and acceptance. Okay. Denial is what they'll see. Anger, bargaining, depression, and then acceptance. So this client blaming his wife. Okay. He's blaming his wife for his diagnosis, not trying to take responsibility at all. All right. The correct answer is actually going to be it's going to be the anger, and number 2, actually. So the correct answer is number 2, anger. Okay. All right. I'm sorry. It's number 2 for the stage, but actually it's number 4, anger, for the question. I had to go back to that question. All right. Okay. So on the exact question, it's anger, but they are in the second portion of the 5 stages. All right. So it's going to be number 4 here. All right. It's number 4 here. And then if we go to the stages, he is in the second stage. Okay. So do you know your content? Did you know it? Yes. Yes, you got it. Esther got it. Okay, perfect. All right. So this is an example of basic content. You either know it or you don't know it. Strategies over nothing. Okay, content only. So let's do this one. Are you guys ready? Are you guys ready for another question? And Miss Diaz, did you pass your NCLEX exam as well, Glaza? All right. Hello, Miss Regina and Remar family. I finally passed NCLEX RN. Perfect. Thank you so much. I used the Self Study DVD with quick facts. She also did the boot camp, which is amazing. and always present right here for Facebook Lives. Remar is just an amazing product. God bless you, Remar. Thank you. Thank you, thank you, thank you. Our Facebook Lives are wonderful. I think if you already have the program, the Facebook Live is just an additional element to what you have, and that's why we do it. Quick Facts is definitely a diamond among books, and it should be on every nurse instructor's. I agree. Every nurse instructor's mandatory list. Okay, so everybody's ready for another question. This question actually came from the Instagram page that we have on Remar Review. You guys got to get on that page because I'm able to not only give you additional questions, but if I travel, if I go places, you guys can follow me on the journey there. And it's just another way for us to connect and stay engaged throughout the week. So here is the question that was on Instagram this week. Which of the following groups are considered a vulnerable population for seasonal influenza? Select all that apply. Which of the following groups, all right, are considered a vulnerable population? These are the choices here. And we're talking about influenza getting it. So is it number 1, environmental workers? 2, nursing home residents? 3, pernicious anemia patients? What's that? 4, pregnant women? 5, clients with Guillain-Barré? 6, infants less than 6 months? Well, the answers are coming in. They were all over the place on Instagram as well as the Remar Nurse Study Group. They got a chance to see this yesterday. So we're talking about people who are considered a vulnerable population. Yeah, a vulnerable population for seasonal influenza. Now, if you are not in one of my programs, the DVD or the online academy, when you see seasonal influenza, you should definitely be thinking, what isolation precaution should patients be in if they have influenza? What is that precaution? Remar Nurse, I need you to put the answer down because you see the sneeze, it looks gross. And that virus is definitely contagious. So I see here choices you guys are picking 1, 2, and 4. So environmental workers, nursing home residents, pregnant clients. Is that right? People also have all of them. Everybody here is considered a vulnerable population. This is interesting, all these answers. What saith you? Thanks, Esther. Esther helped us out. Esther said if somebody has seasonal influenza, they need to be on droplet precautions. That's right. Droplet precautions when the disease is communicable within 3 feet. Droplet precautions. Good job. All right. The correct answer, if I 1, 4, and 6. Okay. 1, 4, and 6. The correct answer actually for you guys out there is going to be number 2 and number 4 only vulnerable population. So nursing home residents and pregnant women are particularly susceptible to the influenza virus. Other types of patients, this is the rationale that's on Instagram. You have your diabetes mellitus type 2, obesity, and clients with lung disease are also at risk. Marion will be saying a prayer for you. Yes, okay. And I want to introduce you guys to a very, very easy reference for you all. It's a great resource. It's something when you get off of this live, you can go ahead and do on your own. It is called the CDC website. Anytime you have a disease that you run into and you say, you know what, I really don't know what isolation precaution this is, the CDC website will help you, right? So everybody else might be telling you to memorize this long, crazy list. I want to just let you guys know, you just go to the CDC website and look something up. That's it. Center for Disease Control. All right, Remar nurses, that is what we're going to do. That is what we're going to do. Now, I pulled this right from the website. And it is essentially, they gave you the list of people at risk for developing flu-related complications. All right, so we have children younger than 5, but especially children younger than 2 years old. That is why you can start giving that influenza virus greater than 6 months. All right, so the choice there said less than 6 months, so that's not going to be true. But any child older than 6 months, you can go ahead and give them the vaccine. The elderly, adults, 65 years of age and older, pregnant women, even up to 2 weeks postpartum. Did you guys know that? So sometimes, well, no, most times they will ask a woman after she's delivered if she would like to take the flu shot. Nursing home residents and other residents on long-term care facilities. And then on the CDC website, you know what I found? They also would like to give you some, ethnic groups that are more disposed to getting the flu virus. So cool. All right, Kiana, she said, passed NCLEX in June, still watching. I am glad about that. I'm glad about that because we're a very robust community of not only people interested in nursing, people in nursing school, but also working nurses. So cool. I'm so glad that you're here with us today. Feel free to share any of your information as well, anything that you would like to contribute. Another thing that I got from the website is also they gave an extensive list of conditions that will also help you to understand who else might be vulnerable. And so here they are: asthma, any kind of neurological conditions, chronic lung diseases, heart disease, blood disorders, such as sickle cell anemia. So pernicious anemia is something that can be cured with a treatment. So that's not considered a blood disorder so much as something like sickle cell, which you could see on NCLEX for this. Liver and kidney disorders. Clients with long-term aspirin therapy can be predisposed to the flu. And I'm telling you these things, but if this is the first time that you've heard this, feel free to look it up and get some background information why a patient that is obese with a BMI over 40, would be more predisposed to influenza, because that's a quick answer that you can look up. So Philomena, you're asking me when is the next 7 days of NCLEX? Really? 7 days of NCLEX, for you guys that you don't know, it is an amazing event that I do. We're literally 7 nights out of the week I go live on Facebook and we go over a great topic. So speaking of that, on Monday, I have a major announcement for you guys. So Philomena, I wasn't going to tell anybody, but your question here brought it out. So on Monday, for Motivational Monday, I'll have a huge announcement for you guys. You're going to love it. You're going to love it. Okay, back to the lecture. All right, so I got this question asked Remar. All right, so hey, Regina, if the patient is taking lithium, should we reduce sodium or not give it at all? So content questions here. Oh my goodness. What about this? What do you guys say? How is the relationship between lithium and sodium? Should we keep our patients away from sodium if they are going to be on lithium? And this is a very relevant question for anybody who is preparing for NCLEX. So I see the answers here. No, don't reduce sodium. If you guys don't know this answer, take a moment, write it down so you can go back and study it after we review. All right. So here's the thing for you guys. This is the quick answer, and this is what I responded back to the student. No, when a patient is taking lithium, they need sodium. So we actually monitor their sodium levels, and we tell them to include in their diet foods that will give you sodium, right? So I guess a better question is this, Regina, what is the issue with lithium and sodium? Why do these two things interact the way they do? Why do we have to monitor them so closely? Yes, and I love that. I love the answers here in this community. So the low sodium level can cause lithium toxicity. So let me see here. All right, let's do this. Lithium is normally used as a psychiatric medication. It was found that patients who take lithium are able to stabilize their moods. So lithium is a very effective medicine for patients who have bipolar disorder, meaning that they have phases of happiness or mania or phases of depression. So they go back between mania and depression. That's why there's two. It's called bipolar disorder. Lithium helps to solve that problem. The only thing about lithium, though, is it has a very narrow window of working. So we call that therapeutic index. It will be working 1 minute very fine, and then all of a sudden you have too much lithium in your system. And the reason why is because lithium is able to basically take over the intrinsic pathways into the cells. So normally the cells are very protective about what comes in and out of them. And they only like to have certain electrolytes come in, right? So what are the electrolytes? You guys, come on. What are the electrolytes that are entering in and out of the cells so that we can have healthy cardiac activity, healthy homeostasis, healthy breaking down of, glucose? What are the three electrolytes that are in and out of the cells on this like pathway? It's like a train in and out of the cells, the three electrolytes. We know electrolytes always end in IUM. Yep. So Medell says potassium. Absolutely. Potassium is free flowing in and out of the cells. Potassium, sodium. There's one more. Potassium, sodium. What else? Potassium, sodium, calcium, right? So yes, these ones, they free flow in and out of the cells, potassium, sodium, calcium. Well, don't forget that lithium ends in IUM. So lithium is also an electrolyte. So what it does is it watches the other electrolytes go in and out of the cells, and it says, I'm about to hop onto this train too, because hey, I'm an electrolyte, it's all good. So lithium gets into the cells, but the cells, when it gets into it, it's like, what is lithium doing in here? And they can't get it out. So it's into the cells and it's stuck in there, and all of a sudden there's this great buildup of lithium. Oh my goodness. So because there's not an effective way to really get it out of the body, medical intervention has to come into play, right? Medical intervention has to come into play. And normally it's dialysis when there is an issue of lithium toxicity. And nobody wants to really do dialysis. Well, yeah, nobody wants to do dialysis. So it's very complicated to treat lithium toxicity. It's best that you don't even go there. All right. So yeah, lithium is an electrolyte that takes over that sodium train into the cells. And so they kind of compete for each other. So if you don't have enough sodium present, lithium will step up and take the place of it and go right into the cells. That's kind of my way of explaining it. So I hope you guys understand how that works. But anyways, that is the relationship between those two things. So let's move on. Let's move on to my next question that I got. And thank you for that awesome compliment. All right. So my next question was, hey, Regina. Hey, Regina. I'm having a hard time understanding urine specific gravity and serum osmolarity. Please, please help. Okay. I got 3 emails like this week. Something about urine specific gravity. I don't know if you guys are all watching the DVD program at the same time or not, but there was a complication between what is urine specific gravity, like what is the urine going to be like, what is the cause of it. So here is a quick explanation on these things, so that when you think about if the urine specific gravity is high or low, you know what you're dealing with. So here it goes. When the urine specific gravity is high, this means that your urine is really concentrated. All right. So think that dark, smelly urine. All right. There's many particles in the urine, because that's what the urine specific gravity is essentially telling you, that there are many particles in this urine, is very concentrated. So this is what you're going to see. When the urine specific gravity is high, it is normally caused by some issue like dehydration or renal failure, where you're not getting that filtration that you need. So the urine comes out very, very, very concentrated. All right. So when the urine specific gravity is high, there will be many particles in that urine. Did somebody else pass that? Am I missing something? Nancy passed? Whoa, passing 75 questions? Really? I am so happy for you. I am so happy for you, because you were in the study group saying, pray for me. Pray for me. Yes, that's amazing. Ow. Yes, please. Can I see your video, please? I mean, you were really active. A lot of people know you. Your testimonial will really spread and motivate. Yes, tell us, please tell us how it was, because you've been studying with us for some time and extremely active in the Remar Nurse community. So please, Nancy, tell us, please tell us. All right. So, all right, so let's go and talk about when the urine specific gravity is low. I'm so excited for you, Nancy. I'm so super excited, man. Okay, you graduated in 94. That is just crazy. That is crazy. Okay, when the urine specific gravity is low, then that means there is a ton of fluid. There's a ton of fluid and not many particles. So this happens when you have like fluid overload or SIADH. Okay, you guys know when we do the review on that subject, that is one of the things that you will see. Your patient will be very diluted fluid. Okay. So this is kind of the relationship. Take notes on this if you need to go back over it again, just so you know urine specific gravity. Now, there was also another question about serum osmolarity. This by itself is only used to tell you how many particles are in a solution or fluid. Okay, so just commit the definition to your memory in terms of what you are looking for. All right, what you are looking for. And there are many applications and many principles when it comes to urine specific gravity. So if you are studying, for example, renal failure or another condition where the output of the urine is specific, go ahead and take a minute and just kind of in your mind anticipate what the urine specific gravity will be, and then look it up to see if your assumption is correct, because you can kind of anticipate the laboratory values of your patient based on the diagnosis. And once you're able to do those things, like really bring the content together, you're ready for NCLEX. You have a good picture of what your patient needs. This exam is all about client needs, safety and client needs. And so having the content and being able to put it together is going to help you on that test. It really, really is. And so I am really excited that today we got to talk about some things that you may have not come across in your studying with REMAR Review. And if this is your first time, I hope you get a sense of really what our community is like. We're a community of encouragement and knowledge sharing and prayer as well, definitely. So it doesn't matter if you haven't thought about your NCLEX and you're watching it, or if you've already brought in a lot of other resources, or even if it doesn't even matter if you failed the exam before and you're trying to get back into studying. We have something for you here in this community, and we are committed to helping you get out of the rut of just studying not consistently or trying to answer a whole bunch of questions. Like we are all about you making the connections to consistency, motivation, and goal setting, because you cannot do any of them without the other one. You will not accomplish your goals if you're not consistent with studying. You will not pass your NCLEX if you don't know the content, and you definitely need the motivation to keep you going on this journey. So we're a faith-based community for sure, and it all helps. It all helps. And so if you're studying with a resource that's not meeting those other components of the process, you definitely want to stick around right here, because we look at the entire scope of the exam. So congratulations to everybody that came on here and shared their testimonial with us. Monday, I have a huge announcement. So I'm looking forward to seeing you guys for Monday Motivation. We do it at 12 p.m. Eastern time right here on Facebook. I really love the questions today, and I'm looking forward to going over more, but I need you guys to email them to me. So email me, please. Email me. My email address is support@remarreview.com. And this is where you can go ahead and share your concerns, your questions. Also, we take prayer requests right there on support@remarreview.com. You know what? Before we leave, we have to say our class motto. I'm not going to say it. Just type it. Type it. If you know what our class motto is, because you're a REMAR nurse extraordinaire, go ahead and type it in so I can read it. 7 days of NCLEX. My last 7 days of NCLEX, you might be able to find that on YouTube. You probably won't be able to find every day of the 7 days because they were Facebook Live events. And so we don't keep them up all the time. We don't keep all of the Facebook Live events. Like hush, Regina. That's all I got to say. Okay, I can. Okay, we're almost there. What's next? Yes, Deborah, thank you for picking it up. I will. And I must pass NCLEX. Yes, the three. We can, we will, we must pass NCLEX. Pow! That's what we say. And you absolutely will, can, and must. You might have to will yourself to believing that you can, and then I'll get on and tell you that you must. You absolutely must do it. If you are excited to embark on this journey of studying for your NCLEX exam, stay connected to the REMAR family. And if you are interested in any of the products or any of the books or the lectures that I do on a regular basis, check out the website and use the discount code REMARNurse, and you get 10% off any product that you desire to purchase. And we have question banks, we have quick facts, we have the online program. Pow, we have it all. We have it all right there. So congratulations. Send in your emails to me. Okay, I will answer them. I answer them typically in the order that I receive them. So you guys know how crazy my email list can be, but it's all good. I get to them. I answer your questions. I go back and forth. I really appreciate the nursing students that email me on a very consistent basis, because we grow together and we learn together. So I am going to continue to transfer what's in my big head to you guys so that you feel great. Is there a package for someone who's about to take it in 30 days? Yeah, you can do. Our program is normally 6 weeks and it comes with a study calendar. But if you're interested in taking it sooner, well, here's my expert advice. If you have a test in 30 days and you come to the conclusion like, man, I really need to study content, the very best thing for you to do is push that test back so that you can fully prepare. Don't feel like because you set a test date that it is in stone, because it's not. You can always change your test date. It's free to do. It's totally free to do. It's more important that you're fully prepared than just keeping a date, okay? Really, nobody should even know when your date is. You should be able to move it in and out as you need to. So that's my number one tip. If you want to do a full content review, give yourself the opportunity to fully study it without the stress. So change the date. If you cannot change your date, my program comes with a 6-week calendar, but built into that calendar are rest days that are very important. So what you would do is just simply not rest on the days that you're supposed to rest, and you would study throughout the calendar, okay? So that's my advice to you. I still think it's prudent for you to go ahead and get the material so that you at least have them, and then you can gauge how you want to negotiate, So rescheduling is $50 in California. Even $50, I think, would be worth it. December 10th. That's plenty of time. Yeah. If your ATT isn't up until December 10th, you have plenty of time to go through the program and prepare. Yeah, so different states are going to have different fees, but it's definitely worth it to give yourself more time on the back end. All right. What is your advice the day before the exam? Oh, last minute study tips. First minute study tips is make sure you have done a program. Then after that, the day before the exam, I would not do any studying at all. All right. Because whatever you don't know by the day before your exam, you just don't know. All right. You just go in there, you take that test like a man. All right. Based on whatever you have done. If you can't sit still and not study, I would practice writing down what you're going to put on your whiteboard as resources for you. So just get in the habit of writing down the labs you want to write down, any formulas you want to write down, any medications, whatever, your weak area is. Practice writing that down like 3 times, right? And then you will be comfortable to think like, okay, these are my resources that I'm going to use. Other than that, if you can go to your testing site the day before, just do a drive-through at the same time you're supposed to test, so you know how traffic is, you know where the location is. When I took my NCLEX, I actually took it in Washington, D.C., even though I was applying to the Ohio Board of Nursing. So I was new to D.C. I didn't know much about downtown, which is where I had to take it. So I went there. I believe I went there twice, just so I did not have to put that on my list of things to think about. Like, I already knew where I was going and what the traffic was going to be like in DC. So those are things that you can do to kind of alleviate the anxiety. I also would watch what I eat the day before. I don't see a lot of people talking about this, but essentially what you're eating the day before will affect you on how you perform on your exam. Also, what you eat the day of. Do not consume anything that you normally don't drink or eat. So don't take a Red Bull to keep you awake, during the exam. Don't eat sugary food that's going to crash you in the mind mentally. Like, what you put into your brain is going to definitely affect how you endure the exam. It's like a marathon. So eat things that will help you sustain your energy during that 6-hour test, because go in there expecting to take a 6-hour test. Don't let, after you hit 75 questions, you start to get mentally fatigued. All right. Don't do it. Don't do it. Just make sure. Yeah. Just make sure that you eat. Don't take any pills. I agree. Don't take any pills. Okay. Okay. So I see a lot of questions about when am I coming to certain locations. Really, 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 I get this question a lot. Hey, Regina, I know you work with schools. I know you work with hospitals and things like that, but do you do one-to-one or do you do live? The best way for you to get an extended period of time studying with just me, I'm telling you, is going to be either the DVD package or the online academy. Those are the programs that you go through. Everything I do in 2 days, you can do in a more, because what happens is when I go to a place for 2 days, I'm there, the student takes notes, and then I leave, I go to another city. But I have students even who come to the live reviews and say, I'm here, but I want the DVDs because I know I need to hear the information again, go over it again. So I'm telling you guys, that is the way to get me into your home, and you don't have to worry about dates or taking things off. It is the best way to get the information. Okay. Yeah. Yes, you guys. So I am based in Ohio, actually. I'm based in Ohio, but I do go everywhere. All right. All right. So you guys, also, if you want to keep the conversation going, feel free to email me, support@RemarReview. Definitely. I really need to come to New York. I know I really miss New York. I usually go there once or twice a year. Okay, definitely. I know. Definitely. All right, you guys. Okay, so I won't keep you guys any longer here. What is going to happen is you all have to attend Monday Motivation. All right, you all have to attend Monday Motivation for the super duper big announcement. I'm telling you guys will be very happy. 6 weeks to prep for your NCLEX with that DVD program. Just go to the website and check it out. The website is remarreview.com, and see if what the product contains will help you to reduce the anxiety that you're having and help you get over the pieces and not just having pieces and actually being able to put it together. Quick facts: if you need a calendar, let me see, to study the quick facts. Yes, there is a calendar with the full program that breaks down how you're supposed to study the quick facts. Okay, so that is definitely a resource for you guys. The DVD study calendar, it is going to help you to break down that quick facts content. All right, you guys, so I'm going to jump off here. I want you to email me if you have any other questions. I'll be on Monday. We can do a short Q&A as well there. But have a great Friday. Have a great Friday. And thank you guys for doing Let's Talk NCLEX with me. We can, we will, we must pass NCLEX. Bye, guys.